Hello friends, let us now learn about sentinel lymph node biopsy in this chapter. Sentinel lymph node biopsy. Sentinel lymph node is the first lymph node which receives lymph directly from the tumor. If you see the first, this sentinel lymph node is first described by Cabana in carcinoma penis, and this sentinel lymph node biopsy was previously in carcinoma penis. This sentinel lymph node biopsy is called as Cabana procedure. Then later this sentinel lymph node biopsy technique has been established to have good role in carcinoma breast, carcinoma penis, malignant melanoma, head and neck surgeries it is used, and it is also used in vulvar carcinomas. So what is the main indication of this sentinel lymph node biopsy? Indication is if there is clinically non-palpable axillary lymph node, then we do the sentinel lymph node biopsy in breast cancer. So here there should be no clinically palpable lymph node, because if clinically palpable lymph node is present, then that confirms that there is some lymph node metastasis. So we do not need to do this sentinel lymph node biopsy. This sentinel lymph node biopsy is majorly done to find out whether there is to find out what is the first lymph node and whether there is any metastatic deposits in that lymph node which are being missed. Okay, so there are two techniques which are present for obtaining this sentinel lymph node biopsy. One we call it as blue dye technique. Second we have radioactive colloid technique. In blue dye technique we will mainly use a dye which is called as 1% lymphase urine, which is also called as this 1% lymphase urine is also called as isosulfan blue, or this is also called as pattern V blue or methylene blue. So we will inject this methylene blue. We will see the procedure in a minute. Whereas in this radioactive colloid technique, we are going to use mainly technetium 99 labeled sulfur is used in this radioactive colloid technique. Okay, now if you see the procedure of this technique, first you will inject the dye or radioactive substance. This is injected into the tumor, or it is injected subcutaneously around the areola. You can inject it subcutaneously around the areola, or it is directly injected to the tumor. Then once it is injected, now this dye will directly go into the first lymph node which this tumor or the areola will infiltrate. Okay, it will go into the first lymph node, so that is the sentinel lymph node. So this radioactivity is detected by using a gamma probe. By using a gamma probe, we will detect the radioactivity of this sentinel lymph node. If it is dye, there is nothing to worry about. You can see the color can be detected, right? So based on that you will see the sentinel lymph node. So once you will see the sentinel lymph node, you will remove the sentinel lymph node and you will send it for biopsy. In the biopsy, if it is found to be positive, then you will have to do the lymph node dissection should be done. If it is negative, then you can spare the lymph node dissection because this is not involved. Right, now if you were asked about the complications of sentinel lymph node biopsy, then the most common complication, it is skin tattooing. Skin tattooing is the most common complication, and most common nerve involved in this sentinel lymph node biopsy is intercostobrachial nerve is the most common nerve involved. Then contraindications of sentinel lymph node biopsy includes if there are palpable lymphadenopathy, then we do not need to do any sentinel lymph node surgery. If there is prior history of axillary surgery, because if we have the if the patient has history of axillary surgery, then obviously the tissues in the axilla have been manipulated in one way or the other, so this won't help. And if there is history of chemotherapy or radiotherapy to the axillary region, even then we would not do this sentinel lymph node biopsy. Or if the breast cancer is multifocal breast cancer, then we would not do this sentinel lymph node biopsy. Then sometimes this sentinel lymph node biopsy is also associated with other complications, like it is associated with necrosis or anaphylaxis, or it can be associated with urine discoloration. So these are important points about the sentinel lymph node biopsy. Thank you for watching.